Hi, how can I, working with you, get the most out of your anti-wrinkle or botulinum toxin treatment? This is a prescription-only medicine and it's very nuanced. It would be lovely to see it as a medicine that you could have injected. It's going to work quickly, it's going to last 6 months, and then it's going to wear off quickly with very few side effects. And like a lot of things in life, it's way more subtle and nuanced than this. If you give 100 people paracetamol, people are going to react differently to it, and some will get a longer duration of pain relief out of it, some will have a faster onset of action, and it's the same with botulinum toxin medicines. They're very subtle in their differences, but also there's a lot of similarities between some of the commonly licensed brands in Ireland. With most of these medicines, when you do a treatment, it starts working within 1 to 3 days, and you'll get your peak or full result at about 2 weeks. Very soon after that, you'll gradually see a little reduction in action, which means recurrence of your movement. Very gradually, week by week, you'll see the movement coming back. I think of it a little bit like getting your hair done. It looks great on the day, the colour's great, and then very gradually, week by week, you'll see regrowth happening. And the same is happening with your botulinum toxin. It's wearing off and the muscles are regaining some of their activity. For most people, it'll last between 3.5 and sometimes 4 months. Traditionally, we said, lasts up to 6 months, and that really is just not the case. I have a couple of people who it may last 6 months in, but those are outliers at either end of the curve. And unfortunately, we'll all have some people who don't get as long out of it. These medicines are dose dependent, so the more you put in, the stronger the result, plus the longer it'll last. And so that's the caveat. If you want a natural result, you're not going to get a huge amount of time out of it. There are certain things I can do to help you get longer. One is to really maximize your skincare, because botulinum toxin is a muscle treatment and it stops that muscle tugging on the skin, but you also need SPF and you need some basic ingredients for your skin. The other thing I can do is I can keep my toxin super concentrated, so there's much less chance of it spreading. It tends to stay put better, and I think it'll last longer. And then it's picking reliable brands, sourcing them properly, using them properly, storing them properly, so that I get the best result for you. And then the other thing is just matching expectations, so that we know it's not going to last the same amount of time in everybody. But come in and have a personalised consultation. We look at your muscle movement, your lifestyle, your medical history, and get the best result possible. Take care. Bye.